Well, it is once again Money Monday, and as if this time weren't confusing enough, it is now open enrollment time, which means that you have to make all your decisions about your health benefits for 2021 at this moment. We can't tell what side is up or down. We've got Kyle Alexander, look at me, I'm meshing the names. Kyle Winkfield from Finley Alexander joining us now. How are you?
Doing well.
I'm glad you're here because we need you to just break this all down for us. Deductibles, they are skyrocketing. COVID-19 is wiping people out physically and financially, and lots of people just can't afford to seek the medical treatment that they need. I'm wondering, Kyle, where do we even begin when we start to talk about open enrollment and making these changes if we have to make them?
Taking a look at what all of the options are and looking at your cash flow and saying to yourself, okay, how often do I visit the doctor really? How often did I visit in 2020 this year? Again, making sure you do get some coverage that looks similar to what you have currently, so that if things change in 2021 for you and you need to visit more often, because none of us knows the future, so something could come up and you want to be prepared and have that health insurance in place, because again, the point of insurance is transferring that risk, because it can get really, really expensive if you do get sick. So make sure you do sign up and enroll, because once that window shuts, it gets really difficult to secure coverage.
Yeah, I think it's difficult, at least for me personally. It's sometimes I feel like when I get a new job, I get like the Rolls Royce of insurance. I was like, give me all of it. And then later on, I'm like, okay, I didn't need all of that.
Right.
But I feel some sort of way about cutting back just in case. But I think you're right, just to sort of be honest with yourself about what you're actually using or what you think you're going to need, because by this time, we sort of know.
Yes, yeah, you're right. You are correct.
So talk about how this looks for our budget. I guess you can't really budget that thing. Either you need your insurance or you don't, but we do.
Right, yeah, so to that point, I mean, like, well, how do I budget this? Deductibles are going through the roof, or co-pays are going through the roof.
Yeah, you got to pay it.
Yeah, you got to pay it. But here's the thing: if you don't have the insurance, what do you think the bill's going to be? So I think taking a look at your bottom line and saying, okay, the cash flow obviously is going to be lesser because I got to pay this much out, but being okay with that, because especially during times for those of us who've been able to maintain employment and maintain cash flow and paychecks in the household, what I have seen is a lot of people have actually not spent as much money this year, because they are sequestered at home and not doing all the traveling, all the things. So there might be some extra cash flow built up in savings by default. So hopefully you took some time this year to get rid of some debts, but hopefully you've been saving that money. If you haven't, start socking some of that away in anticipation of the fact that your deductibles and potentially copays are going to be going up higher than they were this current year.
That is true. Many people have been saving, but I think in 2021, that's going to change, because there are a lot of quarantine babies that are coming in 2021, a lot of expanding families. So I feel like you've got to budget for that too, because if you know that that's happening, then you need to be ready.
Oh, yeah.
So how about retirees and applying for Medicare and Medicaid?
Well, yeah. Well, so let's differentiate. Everybody, when you turn 65, you got to hop on Medicare. That's the rule. Okay, so the first question is, how do you pay the Medicare premium? Well, you can pay it out of pocket, but if you file Social Security, typically it's deducted from your Social Security. And so one of the big, and I don't want to get too technical here, but one of the big pieces there is maybe at 65, when you hop on Medicare, you've got a certain income, like as you're still working. And then when you retire, your income might be reduced a little bit because you're not getting the full paycheck. Right. So there's something called IRMA, I-R-M-A, which determines what your Medicare premium is going to be. So they're looking back on the previous year's tax returns and saying, well, you made X, so now your Medicare premium's this. So understanding that there is some flexibility there when you retire fully, and if your income drops to a different level, then your premium is going to be lesser for Medicare, and you can appeal it. So know that you have that option. Medicaid is if you cannot afford health care at all. And so that option does sit there for retirees, that if you do need some assistance, I always help people understand that Medicare is 65 and up retiree health insurance. Mm-hmm. Medicaid, more or less, for an analogy, is like welfare for healthcare. So if you don't have anything, Medicaid's there to step in.
Okay, got it. Thank you for helping us digest all of these options. Of course, let's remind people how they can contact you.
FinleyAlexander.com.
All right. Kyle Winkfield, thank you so much for being with us. And we'll be right back with more Midday Maryland right after this. Stay tuned.